Let's study something until you become a neonatologist. So today we have a 30-weeker who is about a week old and has been a little bit more lethargic than usual and had an episode of bilious emesis. So you quickly order an x-ray. And this x-ray should scare you quite a bit. You can see there's some gaseous distension, but you can also see kind of like the outline of the bowel wall, and that's pneumatosis intestinalis. Another concerning finding is this kind of like spiderweb appearance over the liver, which is portal venous gas, which is a bad finding in this condition. So this diagnosis is necrotizing enterocolitis, and it's something that as neonatologists, we all very much dislike seeing. It is when bacteria gets within the cell wall of the GI tract and can cause damage and necrosis. So you can actually have bowel death in this scenario. It typically affects preterm infants with low birth weight, but it has been seen in newborns, so term babies. The signs and symptoms are kind of non-specific. Sometimes the baby just may have some feeding intolerance, meaning they have a distended abdomen or they're having episodes of spit up. Something more obvious would be, all of a sudden they're having bilious emesis, their abdomen is firm, maybe tender, they're having blood in their stool. But it's one of those things you kind of always want to have in the back of your mind, because if a baby gets it, they can get sick very quickly, and the mortality is around 50%. Some of the cases of NEC can be treated with antibiotics, so broad spectrum antibiotics. You want to make sure you're covering your gram negatives because you're trying to treat the gut bacteria. So like AMP, Gent, Flagyl would work. And then the more severe cases, kind of like in this x-ray, you will need surgical intervention just because there's probably areas of necrosis, dead bowel that needs to be removed. Sometimes there are intestinal perforations that lead to peritonitis or abscess formation within the bowel. So some of these do require surgical intervention. And then prognosis varies depending on the severity of NEC. There are ways to stage NEC, which is called Bell's criteria. So there's suspected NEC, and it kind of goes off of signs and symptoms and radiological finding, and then there's advanced NEC. Prognosis depends on the severity of the necrotizing enterocolitis, and if bowel has to be removed, how much bowel was removed. There are cases of NEC totalis where the entire GI tract is affected, which is a very poor prognosis, and sometimes mortality is up to 100% in those scenarios. So this is something you want to read your own x-rays because you can act more swiftly than waiting for the radiologist to read it. And you want to always kind of have it in the back of your mind as something to be concerned about.